How can I tell if my dog has a UTI or bladder stones? If you are worried about your dog's urinary health, you might be asking yourself how to tell if your dog has a urinary tract infection or bladder stones. Both conditions can cause discomfort and requiring different treatments, so it's important to recognize the signs. First, let's look at some common symptoms shared by both urinary tract infections and bladder stones. You may notice your dog needing to urinate more often than usual. They might strain or have difficulty urinating, and you may see them passing only small amounts of urine. Blood in the urine can also be a sign of either condition. You might observe your dog showing discomfort or pain while urinating. Accidents in the house, even if they are house-trained, can occur. Additionally, excessive licking of the genital area is another sign to watch for. Now let's discuss signs that are more typical of a urinary tract infection. If your dog's urine has a strong or foul odor, that could indicate a problem. You may also notice inflammation or swelling in the genital region. Sometimes, dogs with a urinary tract infection may dribble urine or leak. In more severe cases, your dog might show lethargy, loss of appetite, vomiting, or diarrhea. On the other hand, there are signs that suggest bladder stones. If your dog has recurrent urinary issues that do not improve with antibiotics, that could be a red flag. Persistent or worsening symptoms despite initial treatment may indicate bladder stones. You might also notice abdominal pain or discomfort. In some cases, bladder stones can cause a blockage, leading to an inability to urinate, which is an emergency situation. So how does a veterinarian diagnose the difference between these two conditions? A urinalysis is often the first step. This test examines the urine for bacteria, white blood cells, crystals, blood, and pH levels. A urinary tract infection typically shows bacteria and inflammatory cells, while bladder stones often cause crystals or mineral deposits. A urine culture and sensitivity test can confirm a bacterial infection and identify the best antibiotic for treatment. Imaging techniques like X-rays or ultrasound are used to detect bladder stones, which appear as mineralized objects in the bladder. If bladder stones are suspected, or if urinary tract infections recur frequently, these imaging techniques are essential. Additional tests, such as blood work, may be done to assess overall health and rule out other conditions. Understanding the difference matters because urinary tract infections are usually treated with antibiotics and supportive care. In contrast, bladder stones may require dietary management, medications to dissolve certain types of stones, or even surgical removal if they cause obstruction or persistent symptoms. If your dog shows any signs of urinary discomfort, it is important to have a veterinarian examine them promptly. Avoid trying to treat suspected urinary tract infections or bladder stones without veterinary guidance, as improper treatment can worsen the condition. Following through with all recommended diagnostics is key to ensuring an accurate diagnosis. Early diagnosis and treatment improve outcomes and reduce the risk of complications, such as kidney infections or urinary blockages.